Very warm welcome to this presentation, the latest deep dive in a series produced by the Centre for Youth Policy and Education Practice. Last year, we conducted the first Australian Youth Barometer, a survey combined with interviews of over 500 young Australians, looking into the kinds of pressures and challenges that they face. Since we launched that report late last year, we've been looking at relationships between different areas of the barometer and exploring and deep diving, as the title suggests, into particular areas. Recently, we launched a deep dive into the experiences of queer young people. And today we're very pleased to have research fellow from the Centre for Youth Policy and Education Practice, Cathy Waite, who was lead author with Beatriz Gala-Cordoba of Realities of Food Insecurity for Young People. So without further ado, I'd like to hand it over to Cathy, who's going to explore what we think is an important but underreported aspect of contemporary youth experience. That is a lack of access to healthy, nutritious, culturally appropriate food. We think that it's a kind of question worth exploring, kind of area worth investigating, and we hope you find something of interest in this as well. So I welcome Cathy.
Thanks so much, Lucas. Well, I'm just going to dive in to our findings, the issue that I want to talk about, which is food insecurity among young people in Australia. And I want to start with the most kind of astounding finding, one of the most astounding findings that we found in the Youth Barometer, which was that 20.8%, or about 1 in 5 young Australians reported experiencing food insecurity during the last 2 years, the 2 years preceding 2021. And that seems like a phenomenally high rate of young people experiencing food insecurity. And so, you know, we can talk about it, we can kind of explore and unpack that statistic, and that's what I'm going to do today. So COVID-19 has really highlighted the phenomena in recent months and years, but there's still a substantial way to go in terms of understanding young people's experiences and coping strategies and identifying effective solutions to the complex impacts of food insecurity. But there are some difficulties inherent in food insecurity research. So like Lucas mentioned, food insecurity is hidden behind a veil of stigma and shame, and also poor visibility in the community. People don't really notice it or clock it as a significant issue when clearly it is something that lots of people are experiencing. Also, common measurement tools, for example, such as those used by the Australian Bureau of Statistics, amongst others, struggle to adequately kind of capture the broad spectrum of food insecurity experiences. Food insecurity, it's a complex phenomena and it's difficult to define. And because it's difficult to define and difficult to capture, there's lots of different definitions that get used. But properly measuring and defining the problem, it's vitally important, because such findings are used to justify and inform interventions designed to address the impacts of food insecurity. So that's one reason to interrogate the way we think about it and talk about it, and also measure it. So today we're going to explore some of those complexities of young people's experiences sourcing and accessing adequate food in Australia. And we're going to look at how experiences in relation to education, work, finance, well-being, and COVID-19 impacted experiences of food insecurity for young people in Australia. So like I mentioned, during the pandemic, food insecurity became quite visible, and we saw lots of pieces in the mainstream media looking at particular populations, particular groups, and how more and more people were using food banks, more and more people were struggling to feed their families. And this is the visibility that I was referring to. And prior to COVID-19, prior to that visibility, food insecurity either was seen as something that just impacted those experiencing the most extreme forms of poverty and disadvantage, or it was seen as something that wasn't really an issue in a high-income country like Australia at all. And because of some of these kind of problems with how it's seen and conceptualized in Australia, there is this a need to improve our understanding, improve our research approach, target our research approach to really kind of advocate for this issue and advocate for people experiencing food insecurity. So young people, the research indicates that so there's lots of different kind of cohorts in the demographic groups in the population that have attracted the focus of researchers, and we're looking at young people in particular. And the research shows that they are more likely to experience food insecurity than the general population broadly. Lucas, did you skip a slide, perhaps? Is there? Oh, okay. Okay, sorry. I was going to just quickly refer to the definitions, but we might have skipped over that slide by accident. But oh yeah, there it is. That's it. Sorry, key concepts. Sorry. Thank you, Lucas. So, and like I mentioned, and the reason I'm going to just dwell on how we talk about and define food insecurity is because it's fairly kind of complex in it, and it's defined differently in different populations as well. But a very, very common definition from the Food and Agricultural Organization states that food insecurity is a permanent physical, social, economic access to food, which is safe and consumed in sufficient quantity and quality to meet dietary needs and food preferences, and is supported by an environment of adequate sanitation, health services and care, allowing for a healthy and active life. And from that definition, again, there are four kind of dimensions that are kind of pulled out, and this is also kind of commonly reported in lots of government reports and literature like that. The first one's availability, which refers to the physical existence of sufficient and good quality food that's affordable, nutritious, and meets dietary needs and preferences. Accessibility, which is the ability to use physical and financial resources to acquire safe, affordable, nutritious, and culturally appropriate food. Utilization, which is the ability to transform food into a safe, nutritionally adequate, and culturally appropriate meal that meets all physiological needs. Things like access to a kitchen, access to cooking utensils, access to, refrigeration, things like that. And stability, which is the presence of the three former pillars or dimensions at all times. So constant and permanent access, availability, and utilization. So financial struggles are key causes of food insecurity, and they're often linked, but exacerbating factors include problems procuring healthy food, geography such as where you live, limited nutrition literacy, and having insufficient opportunity to cook and prepare ingredients. But food insecurity, in spite of the obvious that it's related to food, is not just limited to food, nutrition, and eating. So the complex aspects of food insecurity are diverse and encompass physiological and physical elements. So like I said, it can be stigma attached to food insecurity, like attached to kind of not being able to feed your family, not being able to feed yourself, that kind of sense of shame associated with that. And also feelings of stress. And these are things that can affect belonging and mental health and well-being and so many other aspects of people's lives. We'll skip to the next slide, thanks, Lucas. So, okay, actually, we might skip over onto yes, methods. Thank you, thanks. So, like I mentioned, the data that we're talking about and presenting here about food insecurity was collected as part of the Australian Youth Barometer in 2021. That was a representative mixed method study, including 30 interviews and a survey of 505 young people living in each Australian state and territory in mid-2021. So it was actually during lockdown in some of those states. The Barometer explored a range of topics of relevance to young people in Australia today, including education, employment, health and wellbeing, finances, housing, civic participation, and the impacts of COVID. But it didn't, we didn't kind of target populations experiencing disadvantage or financial insecurity. It was just a really broad capture of young people aged 18 to 24 years in Australia. So we had a few questions in the survey about food insecurity. One of the main ones was, in the last 2 years, was there any time you've run out of food and were unable to purchase more? And that's a question that we adapted from a similar question used in the Australian Bureau of Statistics Health Survey about 10 years ago. I have to check that date. The ABS don't routinely measure food insecurity, but they have done in the past. And what we found was that 105 individuals reported experiencing food insecurity. So that's about 1 in 5. And among the interviewees, 7 out of the 30 discussed some form of food insecurity. And what we found were these were quite insightful stories telling about the vast experience of food insecurity among young people in Australia. So I'm going to discuss some of the findings in the next several slides. And the first finding, and all the statistical findings were statistically significant as well. So the main ones, in terms of demographic trends, particular groups, cohorts within that 505 individuals were more likely to experience food insecurity. So Aboriginal and Torres Strait Islander young people and young people with a disability. So others in Australia have found similar things in regards to those two cohorts, specifically Aboriginal and Torres Strait Islander young people. There's less kind of research on young people with a disability. Certainly older people with a disability and children with disability, but that kind of middle young person cohort of young people with a disability is less well represented in the literature, but nonetheless, both of those cohorts have been reported by other food insecurity researchers. We didn't find any significant differences by age, gender, metro or regional, rural, location, socioeconomic background or country of birth, even though there are others in the literature have found trends amongst some of those cohorts, but we didn't find that in our data. I'll go to the next slide. So one of the main mitigating factors that shaped young people's food insecurity experiences was certainly financial challenges. And that's also, like I said, supported by the literature. It's strongly associated with food insecurity. So just over 3/4 of young people who experience financial difficulties also experience food insecurity. And you can see that in the graph just there. A much smaller percentage of those who rarely or very rarely experience food insecurity, who experience financial difficulties also experience food insecurity. So it's a fairly kind of clear progression in terms of those experiencing and who reported experiencing financial difficulties. Next slide, please. In terms of the interviewees, a small group described quite severe forms of food insecurity associated with financial hardship. So that was things like not having enough money to buy groceries in the local supermarket. And one participant described episodic experiences. So that's sometimes not having enough money to buy food, but sometimes it wasn't a problem, which is still consistent with an experience of food insecurity according to those 4 pillars, which state that you have to have permanent access to food at all times. Yeah, they talked about unstable access to food, including having to skip meals or limited available of suitable food in rural areas. So I've got a quote there. I'm not going to read it out, but it's a really kind of tough story of struggling over time, having to, purchase food while it was cheaper, limiting food purchases when it was more expensive, strategies to mitigate food insecurity. And they were all strategies that person had used and they talked about using. Next slide, please, Lucas. So where people live, the suburb that they live in, the town that they live in, whether they live rurally, regionally, or in urban places, were also key determinants of food insecurity. Young people who said that the food that they wanted to buy wasn't available nearby or in their suburb or town, or who needed to travel more than an hour away from their home to shop for food, were more likely to report food insecurity. And an example of this kind of access dimension of food insecurity was with the young man whose quote I've included just there, who talked about sourcing religiously appropriate food. And they explained they're not always able to maintain religious or cultural food requirements due to poor access at times. So sourcing halal food was unreliable, forcing them to kind of adapt their diet and just eat vegetarian or vegan food, when they had to. Next slide. So food insecurity was also linked to social experiences and eating meals with others. So just under 3/4 of those who report very often not being able to go out and eat with friends or family due to lack of money had also experienced food insecurity, and those who report more often feeling stressed about their relationship with their friends and family and romantic partners also more likely to experience food insecurity. So those findings speak to kind of the role of relationships in kind of healthy and supporting relationships, but also kind of the role of social eating as well in food insecurity. In terms of well-being, we did have a mental health self-rating measure in the survey, but we didn't actually find a clear association between that and food insecurity, even though mental health and food insecurity is very, very strongly linked in the literature. But we did find, we had some other findings that indicated that mental health and food insecurity were interconnected. So for example, 1/4 of those who reported receiving mental health support and just under 40% of those who sought it but didn't receive it talked about experiencing food insecurity. So it was kind of another way to kind of link mental health and food insecurity, but in this case, it was kind of help seeking and failed help seeking as well. Just the next slide, thank you. So in terms of education and work, we didn't link tertiary education with a person's likelihood of experiencing food insecurity, but we did find that employment was quite important, and rates of food insecurity changed according to people's employment status. So I've got the graph just there, which shows that just over 1/3 of those who were out of work but looking for a job had experienced food insecurity. Just under 1 in 5 of those who were employed full-time, and around 3 in 20 of those who were employed part-time also experienced food insecurity. And just under 1/4 of those who are underemployed experienced food insecurity. So we kind of asked quite specifically about people's employment status, and it's possible to see that food insecurity was linked quite intimately to each of those ones as well. Next slide, thank you. And so the one interviewee attributed occasional skipped meals or late meals to a lack of time owing to his work and study commitments. So we did link in the interviews education and employment with food insecurity. And this participant was studying postgraduate degree. They were working in a fairly exhausting, mentally taxing job, and they explained that making time to prepare nutritious food just wasn't possible. And so the result of that was sometimes that they didn't eat it, they skipped a meal, they didn't eat a meal, or they kind of ate a meal much later in some cases. So let's go to the next slide. So unsurprisingly, COVID was strongly linked to food insecurity. Half of those who reported their financial situation was very significantly impacted by COVID, also experienced food insecurity. And just under 40% of those who reported their mental health was very significantly impacted by COVID, experienced food insecurity. So mental health and financial situation have kind of intersected food insecurity experiences here. And it also intersected things like social and familiar relationships and the cost of an access to food in both rural and urban areas. The pandemic also loomed, very large over interviews, some of which, like I mentioned, were conducted during lockdown in some states. So participants reflected on some very well documented food supply chain issues where supermarket shelves were diminished and food choice was limited. Cost of particular foods also became an issue for some participants. Access and availability outside of metro areas. So for some people, these sorts of supply chain issues were an inconvenience, but because we all probably experience them in some form. But for other people, it was a much more substantial impact on their ability to access available food. So that's what we see in the quote, the participant that I've quoted there. And it meant that she couldn't kind of access the food that she needed to. She had to spend more money than she needed to. And it was really a source of significant stress as well. So let's go to the next. So I'm hoping, I think that our findings from this study of food insecurity and using the data from the Australian Youth Barometer has provided some important kind of insights into this hidden, kind of invisible, though quite prevalent issue in contemporary Australian society among young people. So like I mentioned, some groups more likely to experience food insecurity, Aboriginal and Torres Strait Islander young people and young people with a disability. Financial struggles are also quite strongly associated with food insecurity. Those out of work and looking for work or who are underemployed were more likely to experience food insecurity. And those who reported not being able to access suitable food in the local area or who had to travel were also more vulnerable to food insecurity. And also social relationships and mental health were mitigating circumstances. But we did find that young people experiencing food insecurity were seeking help. Particular institutions and NGOs were cited as support avenues. And we know that there's a multitude of food aid support services that are accessible to young people situated within university campuses, for example, as part of community groups, council services, philanthropic organisations or NGOs. In spite of this, though, there still appears to be some significant gaps, and young people are clearly falling through the cracks. So our findings, with our findings here, we're calling for, a need for more local wraparound solutions to support those experiencing food insecurity. And I'll talk a bit more about that in the next slide. And we have some kind of implications here as well, building on what we found. So being employed clearly makes a substantial difference in terms of mitigating the likelihood of young people experiencing food insecurity. So for that reason, governments and policymakers really need to be prepared to assist people, young people, in times of high unemployment and underemployment. Also, better support for young people who are not able to find appropriate or adequate food within the proximity of their homes. So this might include, for example, improved transport infrastructure or guaranteeing fresh food or nutritious food in local areas, culturally appropriate food in local areas. And like I mentioned, particular groups are more likely to experience food insecurity. Aboriginal and Torres Strait Islander, young people with a disability, for example. So proactive and strategic culturally safe support for these groups is particularly crucial. And there are services and organisations that are more likely to be approached by young people experiencing food insecurity, for example, mental health service providers. So because these are services already kind of dealing with young people experiencing other sorts of issues, there's an opportunity for them to act as a point of reference to provide additional support for those experiencing food insecurity or direct young people to appropriate areas. And as it's hopefully evident, the complexity of food insecurity, insofar as it combines financial and physical challenges, accessing food, with other exacerbating factors like mental ill health, family or social dysfunction and location, means that there's an opportunity for wraparound services that can identify and support young people experiencing a range of challenges. And they would also be in a good position to support issues with food insecurity or like mitigating the experiences of food insecurity. So they're just a few things that we've kind of picked out that we think our findings support and that we hope can provide a better kind of safety net for young people experiencing food insecurity. We've got one final slide, I think. So this seminar has been based on a paper, a deep dive, Realities of Food Insecurity for Young People, Insights from the 2021 Australian Youth Barometer, which I mentioned a few times about literature, and I haven't included any sources in this seminar, but there is a full list of references in that paper and some extra detail about some of our findings as well. And the other thing is this work has launched another project on food insecurity, specifically looking at international students and their experiences of food insecurity, which is this project is a much more targeted and detailed look at food insecurity and young people's food insecurity, and especially, like I said, international students and their really unique circumstances and their challenges kind of overcoming food insecurity as international students. And this is a project that's a collaboration with the Department of Nutrition, Dietetics and Food, Dr. Sue Cleave and Dr. Tammy Choi, in collaboration with the researchers at SciPep. We're just about finished our data collection for that project. So it's really exciting and really, really interesting. And a lot of our findings from the Barometer have been supported, but also progressed in this project. So stay tuned for some findings, hopefully a bit later in the year from that project. So yeah, thank you.
Thank you very much, Cathy. That was a great overview of a multidimensional challenge. And I urge anyone watching this video to download the report at the link provided on the screen now, as well as to keep their eye out for future research emerging from this project with international students. These issues become all the more prescient in light of the fact that we are seeing both the effects of the pandemic on particular cohorts of young Australians, such as international students, as Cathy mentioned, but also that we're seeing rising cost of living that are creating further pressures that are likely to flow down through the areas, or some of the areas at least, highlighted by Cathy during this presentation. And on behalf of the team at SciPep, I'd like to thank Cathy and Beatrice for leading this very, very important research. We hope you find it interesting.